I'm going to present an MRSA case. This is a case for a child who was 4 years old, male. He's Emirati. He was 17 kilograms and 102 centimeters. The child presented with a massive swelling occupying the right side of the neck with severe difficulty in swallowing, breathing, and speaking. This swelling has been going on and off for the past year, and it was treated by different surgeons and doctors with the conventional antibiotics. Unfortunately, those antibiotics were not working efficiently, and the swelling kept coming back, reducing a little bit and coming back again throughout the full year. It was a very hard mass that was about 6 by 6 centimeters. The investigations, the new surgeon requested to have blood investigations and MRI, and those both confirmed that there is a massive swelling and chronic infection affecting the right side of the face and neck. So the treatment plan by the maxillofacial surgeon who saw him, the last one, he decided to, based on the MRI and the blood test results, that the case was severe to the point where the child will need to be admitted immediately to the hospital. So then the surgeon did the surgery. He did an open surgery to remove all the necrotic tissue that was mostly in the submandibular gland and some of the soft tissue of the neck. And as we can see, this was the mass that was removed. And also the surgeon took a swab from the surgery, from the infected area, and that swab showed MRSA positive result, which explained why all of this recurrent infection was coming back, because the bacteria was methicillin resistant and the child wasn't taking the antibiotic that's appropriate for that type of bacteria. So according to that swab result, the surgeon decided to give the patient the methicillin resistant antibiotic, but he didn't go for vancomycin. He went for Targocid for 14 days, and he preferred it because it has less side effects. And the swab from the nose then was taken after 14 days, and it was negative for MRSA. So that confirmed that the antibiotic was efficient enough to get rid of the bacteria for the child. And as we can see here, the child was seen after 4 weeks of the surgery, and most of the swelling is gone, and the patient now is active, eating, breathing, and speaking very well. So looking at the literature review, there was a review in 2017 that looked at the prevalence of methicillin-resistant antibiotics in screening patients who are either been hospitalized or who have been an outpatient in one hospital, to see what is the prevalence of methicillin-resistant methicillin-resistant bacteria in those individuals. So they collected 322 pharyngeal exudates and 142 nasal exudates from hospitalized and outpatient for screening purposes. And then they found that the rate in the pharynx was 27% of Staph aureus, 11.5% of methicillin resistant Staph aureus, and 5% of the MRSA. And then from the nose, they found 35% have Staph aureus and 18% MRSA and 13% of MRSA. So Staph aureus is a pervasive pathogen with constantly changing trends in resistance and epidemiology and thus requires constant monitoring in healthcare facilities, because usually probably this child has been exposed to this bacteria from going back and forth to the hospitals from the beginning to see what is his problem. So probably he had catched up this bacteria from there. Another literature review by Peters et al. In 2016, looking at the efficiency of teicoplanin, which was the same antibiotic that the surgeon used here, It confirmed that it does represent an alternative to vancomycin because of its acceptable bone penetration and possible subcutaneous administration, which will mean that the person will not be required to stay in the hospital for IV administration. So, thanks God, this patient was seen by the appropriate surgeon who finally was able to properly manage the case, because this child has really suffered for 1 full year out of this problem and it wasn't diagnosed properly. So, whenever there is an infection that's keep recurring, definitely a swab should be done to be able to culture and see what is the reason and what type of bacteria is there, so that we can give the appropriate antibiotic that will help and solve the problem and heal the situation. And that's all. Thank you very much.